name is Dr. Rick Seguil.
And action. Hey, Jay, this is Kirk again.
And action. Hey everyone, it's Dr. Rick. And a few people, Joe, Selena, and I don't remember who else, but a couple folks were asking me about what to do with regards to boosting the immune system for anticipation of this crappy pandemic that's going to hit us soon. We are certainly hitting the blooms as far as looking online with the Hopkins daily map of the world. But in New York, they're suffering. In Illinois, not yet, but it's coming this way. This is just the behavior of the virus. So hopefully different matters will work to our advantage, kind of like Italy. They had Milan, which was terrible, but Sicily and different parts of Italy didn't respond the same way. So there might be something in this method. So this is the first time you're finding me. Don't forget to hit the subscribe button and share this or give me a thumbs up. It helps the channel. If you know somebody else that's kind of torn on what to do, there's a lot of information out there, and some of it is legit, some of it is kind of screwy, but we got stuff to talk about. So you'll have to refer to my previous videos as far as cytokine storm. That's the issue that usually puts people into death when they get in the hospital. Just the viral load is so fast, so large that body tries to react. In a nutshell, it overreacts and you can't stop it and you can't breathe. Also did a couple of things with regards to CBD from medicinal cannabis. And so check out the other, I'll put up the links down below. But subscribe, because I'll be doing a lot of these things. So I'm going to go through a whirlwind of different things to help you understand what I understand. So I'll flash these things up one at a time. However, in succession, this study was, hopefully you can see this study, yes. So, excuse my handwriting, but this study was on Cordyceps sinensis. That's a mushroom. And Cordyceps, just to go through this paper presentation, Cordyceps, when you used it with something called the Canna and Virus, it did help with regards to improvement in blocking mRNA. Now, Corona is a RNA virus, and if you can block mRNA, it might prove successful or helpful at least. Now, again, there's no great studies on Corona or COVID-2 because it's a novel virus, but hopefully if you learn from how the body and how herbs responded in previous viremia or other viruses, it might work. And I'll tell you why I think that would work. This study is on the mechanism of how some mushrooms work. Reishi, shiitake, and maitake are three different mushrooms. You'll probably see them in your food sources because they do come where you can buy them over the counter. That's not what the studies are about. That's for your food. But if you take it in high concentration, you might have a good result without any side effects, and I'll present why. So the basic mechanism is that those three that I mentioned in this study, these are all from NIH, by the way, NIH's website. The three mushrooms produce mostly beta-glucan. Beta-glucan seems to be the active ingredient that makes things work or improves immunity. Again, that's just a mechanistic study. This is this just mentioned that there are 5 different mushrooms that they studied with the application to cancer. And my cancer docs, especially integrated cancer, utilize the different mushroom extracts robustly. So because of the fact, and I'll present it later, that there's low side effects with women, with kids, with patients who have, not women and kids, but patients who have cancer or other disease processes, tuberculosis. So low side effect profile, and even at highest doses, but yet excellent immunomodulating properties. So this is just, I wanted to show you what a mushroom looks like. I'm sure you know what a mushroom looks like, but the active ingredient that you get the beta-glucan from is the micelle. That's the bottom part of the mushroom. If you pull it out of the ground, you'll see these little hairs. That's the active ingredient. That's where you get the active ingredient. So you can certainly get it from the whole mushroom if you eat, but you'll have to eat a lot to get an accumulated dose. And some mushrooms are poisonous, so you have to be careful. This also shows the a listing of 5 different types of mushroom. So you can pause this and read on your own if you want to search the weird names. And then this illustration was the inflammatory response. So this, in most people, is the inflammatory response, is what happens when you present something of a stimulus to the body, and then ultimately these cells turn on. But this is what this is where the action occurs, these stars. And it works along several different spots to turn on ultimately the attack or your body's attack system. Shiitake is a common one. It can be used to, at least this study showed that it decreased apoptosis in T cells. Apoptosis is when you have cell death. Sometimes, like in the cytokine storm, you'll have a lot of cell death. And if you kill this is a blood vessel, this is a lung alveolar sac, and these are lung cells. And when there's an infection inside the sac of the air cell of the lung, the body sends or migrates the immune response cells, there's several different ones, out of the blood vessel and into the sac. And in many cases, if you destroy that because of inflammation, destroy some of the good guys, that's collateral damage, you'll decrease the immune response and the fight. But again, when you see that inflammation helps to decrease the apoptosis and keep the good guys, the police, intact, you'll have a better fight. So I'm just going to load a couple different more. So this is regarding, so that was shiitake. This is regarding turkey tail, also another mushroom. And this mushroom, this study showed essentially a low side effect profile. So low side effect profile at 9 grams per day. And if you look at, here is something, I like this company. And this company with its turkey tail, I think it's 47 grams or 46 grams. I don't have my glasses, I can't see that. But that should say somewhere up here, 46 grams of milligrams, 46 milligrams of turkey tail. Now again, this was 9 grams a day, that's a lot. You can buy Host Defense's just pure turkey tail by itself, and that's 550 milligrams. So a fraction of what was studied, and if they didn't have any side effects at this high of a dose, these doses will be a piece of cake. The question is always, do you crank it up? And I have to say, you have to use your herbs, your mushrooms at the suggested dosing. So I don't think cranking it up to ungodly amounts will increase your chances to immune stimulate. And I just gave a spoiler away. The spoiler here is, will mushrooms help the immune system? And yes, but again, let me just finish and you'll understand why. So this is a study that showed low side effects with kids. And kids, they blended it in yogurt. So again, limited study, but still, when you have kids and folks that are going through chemotherapy with low side effects, what better can you, so if it improves immune response, great. It has low side effects, great. And kids are probably the most prone, kids and old people with cancer are probably the most prone to have side effects if you're going to talk about the side effects. So positive so far. Here's where cordyceps, another one that cordyceps I used to use for energy boosting as far as a mushroom, but in combination with tuberculosis drugs, patients with TB drugs and cordyceps together had a better response than the guys with just TB drugs as far as eradicating tuberculosis, or at least controlling tuberculosis. So good. This was effect with, I had a video, I think I had a video on chloroquine or hydroxychloroquine. If not, hydroxychloroquine is a big buzzword as far as the coronavirus because it seems to improve outcome. I'll probably do a chloroquine video by itself, but if it improves outcome, which I think is because it pushes zinc into the cell to stop the DNA or the RNA polymerase, then why not? If it's got low side effects, it's super cheap, and if you do it with zinc, if you just do zinc alone, you should be improving your success rate. But if you do zinc and hydroxychloroquine together, really improve your success rate. If you can't afford or can't find a hydroxychloroquine, but zinc and quercetin will work because quercetin is also a zinc iono. So it's a carrier. Instead of saying ionophore, just think of the two things, quercetin and or chloroquine, hydroxychloroquine, to be the carrier of zinc into the cell to work its magic. So here was a study where they used chloroquine for malaria and chloroquine plus agaricus. That's another mushroom I showed you on the first list. And there was a synergistic effect of the agaricus and the chloroquine together. So again, chloroquine, low side effect. There are some side effects with it, but when you're trying to fight malaria in the brain, terrible side effect. But when you have a mushroom extract that actually protects the patients with the malaria in the brain while they're getting chloroquine treatment, why not? Especially if it's low side effect profile. This is just the mechanism of increasing natural killer cells and CD69 test results as far as using turkey tail. So T versicolor, turkey tail, low side effects, great results. And it's mostly to show you that the study was specifically pointing to mycelium, those little hairs at the bottom that I showed you earlier, as being the active ingredient, the thing that worked the best. So versus using the fermentable substrates of the mushroom, the mycelium seems to work. Works better at least. So almost done. Hopefully you're following. This is also another paper that showed the mechanism. So if you want to look up these papers, you can just pause, and I think you can zoom or expand and you can see where the papers come from. I don't have the time to splice it into the video, sorry. So this one was mechanism for fungal extracts. I just went through several different extracts or several different types of fungus. Agaricus, reishi, maitake, and a couple others. But this study showed that if you take them all together, you might be better off. The question is, how do you take like a whole bunch of these, or do you go with something that has all of them in the one? Hard to say, but this study said that you should take several to get a cumulative or synergistic response. As far as which ones, again, you'll have to pick and choose your fights. This seems to have a lot of mushroom altogether. The question is, the dose of the mushrooms would be what was studied in those things I came up with. If it's too hard to buy a bunch of different mushrooms, then sometimes getting a proprietary blend would be fine. But the cool thing about Host Defense is that even though it's proprietary, they still list the milligram dose. Usually if you get something that has proprietary blend, it won't put down milligram dose, but that's why I like Host Defense. And I love Host Defense's. This is awesome. So this is what I always use for a sore throat. 2 squirts every couple hours or every hour if you wanted to, and it hits you with a little bit of alcohol in the throat, a little bit of peppermint, but these are the, I don't know if you can see that, but these are the mushrooms or mushroom blends that are inside this thing. Awesome stuff. Helps with lowering the pain, and you get a little bit of mushroom in that. So the question, especially from Joe, was, do you take a blend of something with a whole bunch of mushrooms together? This is a book that Joe gave me. I read through it. So I always question, it's a good book, easy read with nice data and footnotes about inflammatory response, immune response. The only question is, when you have somebody that makes the product, I don't know if they actually make, if Cheatham and Lifton actually make, or there was no, here is I guess their declaration. But this AHCC has a couple of different things of different mushrooms all together in it. So you would think, hey, if you have the most active ingredient of every mushroom family and you put it into a compound, AHCC, wouldn't it be easier, right? I don't have a sample to show you, but this study did say that AHCC does help in cancer. So you already have some studies just on AHCC, in addition to what these guys had written. So would it be better for cancer? Definitely. Would it be better for corona? In theory, it should. That's in theory. just based on the fact that I gave you all of the other data points on the individual mushrooms, at least their extracts. Now, you would think just taking the best of all those extracts in one thing might improve, but I'll show you in a second. So AHCC is activated hexose correlated compound. I don't know how they came up with that, but again, some scientist. However, great discovery. This was AHCC's use in HPV, human papillomavirus. Pretty good results, small study, but it does, again, this formulation of the cream of the crop does help in this kind of cancer. Human papillomavirus causes several different cancers. Most people know of it as if you're going to your gynecologist, cervical cancer, but it also has led to head and neck cancers too. So this is the big fervor, everybody getting HPV shots when you're a kid now, but again, AHCC improvement. This study showed AHCC's results as far as immune stimulating, and it turned on the dendritic cells. Those are cells that usually originate in the brain. They're kind of like white blood cells of the brain that attack. I think I mentioned something before about sleep, and when you get decent night's sleep, these dendritic cells come out and start to chop or get all the crap and inflammation out of your brain. Pretty cool. It usually happens at night when you sleep. Well, it also helps to fight brain cancer, but if you can stimulate those cells even more, why not, you would think, especially if there's a low side effect profile. However, and this is what we'll finish up with, so thank you for listening so far. There was a paper, maybe I'm cherry picking, but one paper that came up with the data that using AHCC wasn't as good as using maitake and shiitake together. So this was regarding measuring natural killer cells and IL-6. If you check out my video I did on cytokine storm, I talked about IL-6, and IL-6 sometimes works in the wrong way. So this is just one data point that says maybe the individual mushrooms would work better than the accumulated mushrooms, or at least the byproducts in the AHCC. So I have to say that with regards to mushrooms, I think it would be useful. If you look at where this trajectory is going as far as coronavirus, you just have to base it on what was done and what happened to China, what happened to South Korea, what is happening in Italy, and unfortunately, as of today, the 25th, what's happening in New York, because what's happening there is coming our way in Chicago. So I think that I would still do zinc, astragalus, and vitamin D high dose. So see my video on Corona herbals, but that would help you fight in case you get exposed to it. Now, decreasing or sheltering in place, what that does is it decreases transmission, so that if you do get sick when the surge occurs, if all the sick people head to the emergency room, all at the same time, the healthcare system will be overrun. The hospitals will be full. They're already full, but they'll be even fuller, and the vents will all be bad because we have great support. The United States is excellent with the intensivists. The United States are excellent with what they do as far as supporting people to get them past the crisis and maybe controlling the cytokine storm. But if we can improve the immune system of people as they're getting exposed and as the virus tries to take over, I think it would be a fair game to lower the amount of people going to the emergency room, decreasing the surge. You can still have a positive result, you can still be positive tested, but you won't progress on to having severe manifestation. And how? I think that if you do the right things with mushroom exposure, this is astragalus. It's not a mushroom, but this is what I use. I have it in my other video. When I'm sick, I usually take red reishi, astragalus, quercetin, and this. That's my usual. But in the case of building up the immune system for the next month or two, I would say I would take red reishi. Instead of the AHCC, I'd take red reishi. There's a combination of maitake and shiitake. This combination is excellent, and I like, again, this company is really good. But if you can get everything at once, all in one, that'd be fine. New Chapter has a blend of mushroom too. There's several different companies out there with a blend of mushroom. I think you have to find your own. I couldn't find anything on Consumer Labs as far as reviewing all the proprietary mushroom blends. But I think if you throw on twice a day dosing of a combination of red reishi, shiitake, maitake, I think that would be fine. In addition to continuing on the zinc, vitamin D, and astragalus. And in addition to maybe getting ready for the surge, I'm doing a fast. So I think fasting is a 5-day fast as far as Prolon and the fasting mimicking diet has been the only studied dietary change that improves immunity. We got to improve our immunity. So I just spoke with a tobacco user today. I said, you know what? If you've ever thought about stopping tobacco, we probably should stop it this year. Understanding that when most people stop tobacco, they'll flare up as far as phlegm and mucus. That's because the lungs are kicking back in their normal function again. But if you get past that and happens to be or precede when the surge occurs in Illinois, I think you do better. Because people who smoke, people who vape, people with immunocompromised systems, diabetics, high blood pressure, heart disease patients, all those are immunocompromised, and your chances of going to the hospital if you get exposed are higher. So most of us that get exposed will be at home, we'll be isolating for 2 weeks, and we'll be fine. And then we'll have antibodies for the rest of our lives, which I'm hoping for, because this is going to happen again. But those of us that have, my patients, my warriors who have reversed their disease, you're cool. My patients who are pre-warriors who are reversing or working on it, you'll be fine. But now is the time to really kick ass and make your lifestyle changes. So hopefully this gives you a little idea. Selena, I think what you showed me online is fine. Joe, the AHCC is nice. Good, thank you for bringing it up to me, but I think for the price, I'd rather do individual mushrooms. So if you have any comments, put them down below. Otherwise, I'll see you at the next Minute Clinic.